Well, nursing has always been a high-stress career, and that was before the pandemic hit.
A survey during the pandemic found 62% of intensive care nurses are burned out. And now we're seeing the long-term impact of that burnout, as CBS 2's Dr. Max Gomez reports.
For 7 years, Paulette Rangel worked overnight as an ICU nurse in Phoenix. When COVID reared its ugly head last year, Rangel and her co-workers stepped up.
Some nurses were working 4, 5, 6 days a week, 12-hour shifts.
Rangel says her training gave her the medical skills to respond to a pandemic, but did not prepare her for the emotional toll.
It takes a lot out of you. We wanted to be there for our patients, but you know, when we're running on fumes, it's hard to do that.
Back home after her shifts, Rangel's distress was obvious.
I would go straight to my room. Talking to my husband, I was just telling him, I really don't want to get you guys sick.
After trying counseling and antidepressants, Rangel switched to a job in community health, seeing healthier patients during daytime hours.
The problems that we see in nursing now are not new. It's that high level that we had before COVID that's made it just really out of hand now.
Linda Aiken teaches and studies nursing at the University of Pennsylvania.
The problem is that we don't have enough funded, permanent, full-time positions for nurses in the settings where they're needed, namely hospitals, nursing homes, and schools.
There are no federal standards on patient-to-nurse ratios. California is the only state that has set minimum staffing standards. Aiken says the workload varies widely, with nurses in some hospitals caring for as many as 10 patients. Some studies have shown that as patient load goes up per nurse, so does the risk of dying in the hospital, even from routine surgical procedures. Christopher Hayes is a prime example of the issue. When COVID struck, he hit the road as a travel nurse. As he rotated through 4 hospitals in Texas and Oklahoma, the staffing shortage wore on him, but not as much as
getting used to the amount of people that were dying from COVID and then talking to their family members after they died.
One thing needs to be clear. You can go to the best hospitals in the country, and we have plenty of them in the tri-state area. They may have the best doctors and latest technology available, but your medical outcome and how you feel about your hospital stay will depend tremendously on caring, dedicated, and reasonably staffed nursing. Dr. Max Gomez, CBS 2 News.